stream.
Tonight, we're going to dig deeper into a medical situation that will shock you.
Absolutely. In the last 4 years at a hospital in Brooklyn, there have been 3 women who have died during childbirth. All of the women were black. There are striking racial disparities at some area hospitals. Black women are 9 times more likely to die from pregnancy or childbirth than white women in New York City.
And now a movement to try to pass a law to make hospitals accountable for women who die giving birth. Investigative reporter Kristen Thorne live at Woodhull Hospital in Bed-Stuy with the story. Kristen.
Well, Bill and Sade, the Grieving Families Act would address a lot of things. One of them would make hospitals accountable for providing emotional damages to people who suffer this sort of tragedy. We want to talk about Woodhull Hospital. It has been less than a year that I was here telling you about yet another woman who died while giving childbirth, and here we are again talking about yet another woman. Bevorlin Garcia Barrios appeared to be a healthy 24-year-old pregnant woman, but that all changed last month when she came to Woodhull Hospital. She wasn't feeling well. Doctors rushed her in for an emergency C-section. The father of her child never saw Barrios again.
The doctor just said that she has to go in, and then after that they come with the news that she was gone.
Nelson Ramirez still doesn't know what exactly happened to her.
I want exactly the same answers that you asking. That's the same thing I'm asking.
We also have a lot of questions because this is the 3rd black or brown woman to die in childbirth at Woodhull Hospital in the last 4 years. It was Sha'asia Washington in 2020. She also had an emergency C-section at Woodhull and then died. Last November, it was Christine Fields. The New York City medical examiner said she died of hemorrhaging from a C-section also at Woodhull.
It seems like the same routine. It's always the same routine.
Fields' boyfriend, Jose Perez, says he reached out to Barrios' family after hearing what happened.
I never met this young man in my life. The reason I met this young man in my life, because he's going through what I'm going through. Something needs to be done. Like, that's what it's really about. Like, we just can't keep having this.
New York City Health and Hospitals wouldn't discuss Barrios' case with us because of patient privacy, but said in a statement, over the last years, we have been particularly focused on helping reduce the unacceptable maternal mortality rates among women of color through innovative interventions. The hospital system also tells us that they have hired new leadership here at the hospital in terms of in charge of the OB/GYN department as well as the anesthesia department. They say they also are requiring new training for people who deal with pregnancy patients. The New York State Department of Health says they also would not comment on this recent case, the Barrios case, saying that they would not comment on matters that are the subject of an investigation. We're live in Bed-Stuy. I'm Kristen Thorne, Channel 7 Eyewitness News.